Disease of Waldenstrom. Waldenstrom's disease, also known as macroglobulinemia, is a form of white blood cell malignancy. Important information regarding Waldenstrom's disease. The following are some of the most notable observations about this disease. When the bone marrow is afflicted with this condition, it creates a significant number of malformed white blood cells that emit substances that are detrimental to the body. Waldenstrom's illness is a chronic, rare condition that primarily affects persons over the age of 60. Tumor cells are concentrated in the enlargement of the bone marrow, lymph nodes, spleen, and liver. Waldenstrom's disease symptoms. The following are symptoms of Waldenstrom's disease: tired, loss of weight, anemia, nosebleeds and gum bleeding, feeling numb in your hands and feet, fever, migraine, distorted eyesight, nervous system damage. The color blue. Waldenstrom's disease causes and risk factors. The following are the causes and risk factors for Waldenstrom's disease. 1. Waldenstrom's illness causes. Waldenstrom's illness has no known etiology, but experts believe it is caused by genetic abnormalities that drive the creation of harmful white cells. These white blood cells create antibodies that the body cannot use, so they build up in the body and cause a variety of issues. 2. Waldenstrom's disease risk factors. The following are risk factors for Waldenstrom's disease. Advanced age. People over the age of 65 have a higher risk of having the condition. Gender. Males are more likely to become infected than females. Skin color. People with white skin are more prone to the disease than those with darker skin. Family history. If any type of lymphoma runs in the family, the risk of developing the disease increases. Waldenstrom's disease complications. Hyperviscosity syndrome, which arises when deformed white blood cells produce enormous amounts of proteins, increases the viscosity of the blood and obstructs its flow in the blood vessels, is one of the most significant complications that can arise from infection with the disease. This illness causes several central nervous system symptoms, such as headache and coma, and can obstruct the heart's work, leading to congestive heart failure, CCF. Waldenstrom's disease diagnosis. The following are some of the tests that can be used to diagnose the condition. Laboratory tests. Blood tests can detect proteins produced by cancer cells as well as evaluate the numbers of normal white blood cells. Biopsy. The doctor performs a bone marrow biopsy, which involves extracting a sample of bone marrow with a fine needle and examining it for cancer cells. Imaging examinations. To see if the cancer has progressed to another part of the body, certain imaging tests are performed. In addition to PET scans, computerized tomography, CT, scans may be employed. Treatment for Waldenstrom's disease. The following treatments are available for Waldenstrom's disease. Wait and watch. If the patient has no symptoms, there is no need for therapy. However, the doctor is confined to monitoring the situation by frequent examinations. Plasma replacement. If the patient develops symptoms as a result of an accumulation of proteins in the blood plasma, a plasma exchange is used to remove these proteins. Chemotherapy. Chemotherapy is a treatment that is meant to destroy cancer cells that are quickly proliferating. It is frequently used in conjunction with other treatments or before a bone marrow transplant. Individualized treatment. This treatment addresses the cancer cell's unique features, leading them to perish without damaging nearby cells, decreasing adverse effects. Biological treatment. This treatment boosts the immune system to combat cancer cells and eliminate them, and it can be administered alone or in combination with other treatments. Transplantation of bone marrow. In some circumstances, bone marrow transplantation may be necessary, which involves using strong doses of chemotherapy to remove the diseased bone marrow and then transplanting the healthy bone marrow to make healthy cells. Waldenstrom's disease prevention. Because the condition is mostly caused by genetic factors, there are no clear ways to prevent it.